Never before have hospitals been under such pressure as the last 7 months, but we should not forget that hospitals are much more than places where lives are being saved and people are taken care of. They are also large organizations with a huge staff to manage, to control, to keep healthy, to keep motivated. Now, Clinique Universitaire Saint-Luc is going through a big transformation on the workplace. It is called Hôpital 2025, and here to tell us all about this big transformation, also with COVID-19 between the ears, so to speak. It's quite a big challenge. So here to tell us all about this big challenge is Renaud Mazy, CEO of the hospital, and Chief HR Officer Isabelle Hennequin. À toi.
Renaud, did you see how tired and under pressure is the staff?
Really? You think?
Technology evolves at light speed.
Yeah, we absolutely need to stay at the top.
The COVID crisis turns our accounts into the red color.
Yeah, but I mean, 15 million gap? Yeah, that's quite a lot.
We clearly suffer from a lack of nurses.
Oh, just 100 missing.
Look at the old buildings. They are from 76.
Yeah, we need $500 million for the reconstruction.
More funding sources have been cut.
Yeah, only 25 million cut since 2014.
And what about our challenges for quality care and digital patient files?
Yeah, we absolutely need a very strong strategy for the future. Let's take a look at the past. Let's go back in 1976, and what was the hospital of the future like at this time?
Twee minuten.
Vaste galette à 4 niveaux surmontée d'une tour de 9 étages, cet hôpital d'une capacité de 900 lits et qui emploiera plus de 2000 personnes dispose d'une surface habitable de 11 hectares. Réalisation qui représente un investissement de plus de 3 milliards de nos francs, dont 60% proviennent d'un subside de l'État. Comme tout hôpital universitaire, les cliniques Saint-Luc se caractérisent par une très haute technicité médicale, représentée par des techniques de pointe comme le pancréas artificiel, la tomographie, l'enceinte de Charlet à flux laminaire ou la surveillance et l'assistance par ordinateur. Mais les techniques de pointe ont aussi été utilisées dans d'autres domaines, comme celui de l'acheminement du courrier, des dossiers, des médicaments ou des prélèvements destinés aux analyses. Ces transports se font ici par une sorte de train électronique desservant tout l'hôpital. Mais à côté de cette haute technicité, les responsables de ces cliniques ont voulu faire un effort particulier dans ce domaine que l'on appelle depuis peu l'humanisation de l'hôpital. Accueilli par une hôtesse, puis conduit à une infirmière qui le prendra en charge pour tout son séjour, le patient se trouvera dans un milieu où ses repas seront servis à des heures plus habituelles, où musique, télévision, distribution de journaux et de livres lui seront offerts. Hôpital de rêve, c'est ce qu'espèrent les directeurs et sans doute plus encore les futurs clients.
Saint-Luc has been leading the Belgian hospital world for 40 years now. It's really our responsibilities to rethink the way we are operating, to rethink the mission, and to see how we will handle the patient in the future. This is an important responsibility. But at the same time, we absolutely need to take a look at the trends of the healthcare, of the hospital world, to see what will be the hospital of the future.
reset or upgrade? The best way to solve this debate is to take a look at the challenges ahead. Let's start with the defining issue of our time, demographic change. Our healthcare system is under pressure to meet the ever-growing needs of an aging population. Chronic and lifestyle diseases will impose a considerable economic burden in the future. As most of these diseases are preventable, many argue that the focus should be on personalized prevention, health promotion, and rehabilitation. Maintaining a sufficient number of qualified physicians, nurses, and allied health workers will be foremost in managing this challenge. Existing roles have to be refined to make optimal use of our diversified health workforce. We must also address the effects of income inequality on health, and how to close the life expectancy gap between the wealthy and the poor. Studies show that a substantial amount of our current health spending could be eliminated without harming the overall quality of care. The traditional fee-for-service payment model is increasingly seen as being too costly. Under a value-based care model, healthcare providers seek to offer better care at a more reasonable cost. Will we end up moving towards a more patient-centric system, organized around what patients need and what they consider important? It's clearly time for a fundamentally new strategy. Or is it?
As you have seen on these interesting videos, the trends are very clear. The changes are huge. In the future, we'll see the ambulatory rise. We will have a more specialized medicine, and we'll go more and more for personalized medicine for each different patient. We'll see a lot of prevention, and our hospital will be virtual more and more. It will be flexible, evolutive, digital, and hyper-connected. In 2012, we have defined our vision of the future. The vision in 2025. You will see that this vision is still very accurate to our situation, actual situation. The vision is the following: the excellence in healthcare, clinical research, and academic knowledge will be measured by international quality metrics. Our motivated and engaged staff will bring our hospital at the core of an integrated healthcare network while building on our reputation and innovation capability. We will deliver a completely reshaped environment, efficient, welcoming from patients, and financially sound to foster innovation at the heart of our project. It was the vision that we have developed and which is still very accurate. To reach this vision, our strategic plan was built on 3 different waves. We have to rebuild a huge hospital, a hospital with 6,000 employees. There are a lot of opportunities to improve this hospital. Then the first step is really the optimization of the hospital. The second is our digital revolution. And what the aim of this digital revolution is really to develop the virtual hospital of the future. And then we'll be able to do the reconstruction of the hospital. As you can see on this timeline, the 3 different waves have started at a different moment, but they are going now in parallel for a very long time. The first step, the operational excellence. The goal was really to work on 5 different aspects. The academic aspect of the hospital, this is a very important one. Another one which is important is the patient partnership. Not only the quality of the cares, but also the fact to involve the patient. Third one is the efficiency of the processes. The fourth is the performance in terms of finance. And for all of this, we need our people to be engaged. We have completely completed dozens of projects through the organization. You have here a small list of some of the projects: the automatization of the central laboratory, the automatization of the pharmacy, the creation of a cockpit at the surgical center, and also the development of a leadership program. But one of the most important was the accreditation. The accreditation for hospital is almost the same as the certification for the industry. The goal is to improve and to continue to improve the quality of care and the security for the patient. We have been the first in Belgium, thanks to the work of our employees, we have been the first to reach the platinum level, which is the second level in Belgium. We have been the first reaching this level. The second wave, the second part of our project is the digital revolution. It's a huge investment that Saint-Luc, the highest investment in digitalization in the hospital world in Belgium. Saint-Luc will replace 400 different applications by one single file, one single system. We'll replace our old technology by the worldwide most powerful and advanced technology, with the goal to improve and to continue to improve the quality of care, but also to boost the research and to allow the arrival of the artificial intelligence. It's a kind of changing the backbone of Saint-Luc and really going with the digital revolution. After optimizing the hospital, after rethinking virtually the hospital and going through our revolution of the digital, now we are ready for the rebuild and the renewed hospital project. You can see on this picture the first building that we will start, for which we will start the construction, which is the building for the oncology, hematology, adult and pediatric. It's a cancer center totally dedicated for the patient. Everything is organized around the patient. And the second one is, the second project of construction is really the new hospitalization tower that we will start in the next following years in Saint-Luc. As you understood, this is key for us to go through the optimization, the digitalization, and then the reconstruction. The goal is to continuously improve the efficiency of care, the efficiency of our teams, and allowing the artificial intelligence coming to the hospital, because it's going to be the next revolution for us. Such a huge transformation is not possible without involving as much as possible the HR team in Saint-Luc. Isabelle.
Thank you, Renaud. Thank you. Accompanying change is also key to make these transformations successful. So transforming is changing, and changing is about engaging people, generating new and sustainable behaviors. And it's where HR can make a big difference. We have all along the project, we need to begin from the start until the end of the project to have the people with us, to have the engagement, to have the people understand what is the vision, what will change for them, and how and where we want to bring them. For this, we have a few succession factors. And in Saint-Luc, we were able, for the different projects that you've seen, and for this big transformation, we were able to bring the people with us all along those success factors. The first one is the context. The second one is aspiration. Then you have the leadership, ideas, energy, process, and all together it leads to success. Context is really make sure that people understand and understand what we want to do, and that this is managed all along the transformation process. Aspiration, to have a clear vision, to bring this vision to the people, to communicate the vision. Leadership is key, is to have the leader who are able to bring also the project, who are engaged, who are competent and recognized. Then we have the ideas and the energy. All along the process, you need to challenge these transformation, to boost also the transformation with ideas coming from different collaborators in the company. And at the process is also key. You have to have a dynamic and also strict process that is clearly managed, so the people know where they have to go and how they have to go where we want them to go. So those critical factors, we have in Saint-Luc put a lot of things and a lot of projects together to be sure that we are able to work in those factors and to have different projects, So the context, you can see the different projects and the different things that we have put together in the context from the beginning, to have the people with us, to begin to think with us what we want to this transformation, and to have the ideas also from the beginning. Aspiration, every 4 years, for example, there is a roadshow where we can present the state of the art of the strategy, so that the collaborators can of course follow. And all along the project, we have also a very strict and continued communication. Leadership is of course, training the leaders to also help them to support the project and the transformation. Is also of course giving training to different people in the different, what do you say it in English, les métiers and functions and so on. Ideas, energy, we have the whiteboards, we put the people together to exchange ideas, to come with new ideas. And we have of course the process, that is also a strict process, project management, to be sure that everybody can follow and know how to do and to go to the success. The message is that strategy and transformation projects must of course ensure your business a profitable and sustainable future. We know that a lot of transformation projects fail. They don't achieve their objective. And why? It's usually not the fact of technical causes and so on. It's usually the cause of the people, because the people have not been engaged, they are not committed, they are not competent enough to be part of the project, to understand the project, and to make the project and the transformation a success. So we need absolutely to develop new attitudes to change, help people to acquire new skills, and above all, put the people at the heart of the performance. So before, during, and after, the collaborators have to be involved all along in the transformation.